Well, welcome. We're now in the process to apply for our EMS programs. Again, we're back at our Kapilani site here. Again, you could just type into your browser kapilani.hawaii.edu, or you can look into a search site to type in Kapilani Community College. We've gone and started our registration, our general registration. We've started to consolidate and reconcile our immunization and health records. And now we want to look at the courses that we're going to take. Let's go into the program studies, credited courses, and we're going to look for EMS. And this would help us to find where we're going. So here you have two different ones: emergency medical technician and MICT, or mobile intensive care technician. For our EMTs, we're going to log into the EMT program here. You can learn a little bit more about what's going on, the contact information, but as we scroll down, we're going to see how to apply for the application. Now, I understand that it mixes it up. There's a transition program. This is for those that are coming out of state. So what we want to look for is something like this, just the general EMT application. It's fillable, but the only problem is that I'm not sure if you'll be able to save this. So you're going to have to be able to fill this out or download this and then fill this out, or print a hard copy out and type this out. So let's see what happens when we go ahead and download this. Let's save this application. I'm going to save this to our downloads here. We should see that pop up. Let's go ahead and open this up here. Can we type in? So, and you're going to go ahead and just continue typing in everything and going down. So we want to make sure that you place in the address that you're going to get the mail that you want to place in the emails that you want to be addressed and sent to. I would prefer that you would use your MyUH or Hawaii.edu. As you submit this, you're going to attend one of the mandatory info sessions. This is where we talk to you about what you are going to be expected and what's the expectations of you as an EMT student. It'll also talk about the type of work that you'll be getting into and what the classroom is going to be about. We're going to have to click on all of these that we completed. You'd click here, and that would tend you to get you to apply. Make sure that you have all your prerequisites for the EMT course: English 100, Health 125, and acceptable grades. Make sure we take a compass test for the math or a qualifying test. We want to then capture all of your transcripts that you may have had both here and abroad. So within the state, any of the UH system campuses, or any college campuses outside of the state. I need you to then also get your driver's abstract. And here it says no older than 6 months from the application deadline. So you can't use something that's old. We want something that's new so that it's up to date. You need to have a current Hawaii driver's license copy, and you're going to have your CPR certification. Make sure this certification is going to be valid throughout the EMT program. Because if it expires prior to you getting out of the EMT program, you're going to need to get it recertified. We need this for the National Registry. It's very important. It's very important. Again, you have to have your healthcare BLS certification with American Heart Association. It has to be current. It has to be done. And we need it for an entire year within this EMT program. They're asking us also to have your first aid or heart saver, which is done through um, American Heart Association. You can submit any other volunteer experiences in work, and then complete your assessments. Once you complete all of this, supplemental documents will be sent to the emergency department. That is us. You'll bring this down to our office site down at the lower campus at the Hawaii Community College, Monono campus. We're in building 380. We're in classrooms 36 and 39. We will start to save your application and you'll work with us to make sure that it's complete. Once it's complete, we'll have to have you go through the interview process to be selected by the Emergency Medical Technician Selection Committee. We'll continue to fill out all these spaces here on the application, including your work and voluntary experience. Verification, go ahead and have this printed out so that we can verify. You want to have a copy placed here of your driver's license, your CPR card, and first aid cards placed there. Now we're going to start inputting your grades and your standing from your previous classes. So we need to know what English you took, preferably that English 100, Health 125, your math or math placement test, and the credits, the term of completion, where you did this, and the grades. If you have any of these MICT requests, prerequisites, go ahead and place these in. These are great so that we can know whether or not you would be a great candidate to continue on with our EMS programs all the way up to the paramedic level. Although they're not required right now, they also look very good for you, though, if you're applying for the EMT program. This is your anatomy and physiology portion right here, and your math 103 or higher. We also have the human development. This is to talk about the lifespan. And then we have other additional arts and humanities courses. We want to make sure that you do your self-assessment. That was supposed to be checked off. So here you want to be able to check in these boxes the knowledge of the profession. What do you know about it? Personal characteristics. What do you bring in? Your strong strengths here, your academic strengths. And where are we going to be successful in this healthcare profession and our course objectives. So this is for the EMT. Let's go ahead and stop here if this is for the EMT program and EMT program only. If this is also for our MICT program, then let's go back to our accredited programs here. We'll go into the MICT program. Here we have our general description of the EMT program, the different sites, pass rates. This is tells us what we've been doing so far in our program. And now let's go all the way down here. And what we're going to be doing is we're going to be applying here with the MICT application. Here's one for Maui, but we can click our general application again. Let's go ahead and download that to the downloads. We'll go ahead and open that up. And similar to the EMT program, the MICT program, we'll then go ahead and fill in our name, mailing address, contact information, and we'd like you to use your hawaii.edu email because we'll be sending important study things prior to getting into class. Apparently, these additional study information, it is only for EMT knowledge and it's not to start studying at paramedic level courses. So it's just to beef up your EMT knowledge exam, beef up your EMT pharmacological knowledge, and to beef up your drug calculations as well as drip calculations as we're moving towards our ALS side. But these are things that our EMTs are supposed to know. Here we want you to put down what island, and we would be putting down Hawaii Island at the Hawaii EMS Training Center. You would have had gone to an MICT info session. We try to schedule these one every 3 months throughout our academic year. We try to do this as you graduate from EMT so that your graduation date from EMT is also the first time that you've gone through the program info session. So we probably have gone through this twice. It does tell us what we're going to be expected to go through as far as the classwork, the clinical work, our rotations, and it gives us an idea of what we need to do as we apply for the course. Complete the application. We can click here. And if we haven't done the application process already, this is the general application to Kapiolani Community College. Now remember, if you're a Kapiolani Community College student and you're returning, go to the returning site. If you are a brand new student to the Kapiolani UH system, then you're going to be a new user. Gonna make sure that you click off these boxes. We'll go back down to make sure that you click these boxes correctly, as you need to get all of this information. College transcripts from all UH systems. We're gonna need to get those. We're gonna need to get transcripts from out of state or anything outside the university system. You'll be preparing quite a few documents here, guys. You'll have to write an essay about this personal statement about your EMT prep. You're going to also need to get a driver's abstract relatively within the 6 months prior to the application deadline, so we can't have anything outdated or old. You need a valid driver's license, so a copy of that. You're going to want to have a current CPR card that's going to last you for at least the duration of the program, or we're going to have to recertify during this MICT course. You need to have a state of Hawaii EMT license, and that needs to be current. We would hope that you have maintained your national registry as well, because we're going to need to create an account later to get our paramedic license, and we're going to be taking tests through the national registry, our written and our cognitive, as well as our psychomotor or skills testing. You're going to document all your work experience, as well as documenting 300 ambulance reports. These transports need to be recorded onto the application document. We can't just bring these case studies, these ambulance reports in, downloaded from WebCur or on scratch paper or on some type of other document. We want them to be recorded on the application paperwork. We need your copies of CME, and as we move forward, this is that health screening record that we're going to need. And you see all of the different immunizations that we're going to require you to have. Once all the application's in, we're going to have a few other additional things. We're going to be grading you on your essay. We're also going to have you go through a skill test. We're going to also have you go through a knowledge exam. And we're going to have you do an interview through the interview selection committee. Now, your knowledge exam is going to be online. That'll be connected through our testing center here at the Hawaii Community College Lower Campus site. It's a secured test. You will not know the results of the test, but you have to take it and sign up to take it. It's going to be required that you come in with some form of valid identification in order to take the test. It's not open book. You cannot take any notes in. It's multiple choice. The psychomotor competency exam, it's basically all your basic national registry skill tests. In that, we do your medical and trauma assessments. So those are the first two. We do your longboard and halfboard or KED spinal immobilization. So those are two. We also do the airway, oxygen administration, and apneic patients. So that's another two. And then we also do the CPR and AED. So I have a handful of tests. These are pass or fail, and everything's graded from the your grades during the academic portion of EMT, as well as all the required courses. So we grade that. We also look at your knowledge exam, your psychomotor exam, and how well you did on your interview, and the essay as grading criteria for you to get into the MICT program. As we move down our application, you're going to then jot in all the information that's required here, what English you took, how many credits, terms of completion, what college or institution, and the grade. So you go down through your English, health, your EMT 120, 125. Now, if you did the EMT 101 and 100 and 101, you just place those in there. We'll be able to clarify and fix it up. FAMR, and then any other of your arts and humanities. Here's a verification for work experience. We need to fill this out so that we can contact them. And this is the important one here. We want to create this log over and over and over until we identify 300 ALS calls. Now let's pause right here. You're going to need to place in the date that these runs were taken, the type of call that you went on. So, was it a 911 call or was it a transfer? You know, if it was a cancellation, you can still put the diagnosis, but the verification needs to be done by your MICT partner that was working that day. Or if you're writing on our extra ride along program that you're taking that college course, you can also log in these calls here. Again, we need to know whether it's an emergency 911 type of call or if you're working on an AMR or a non emergent kind of call. We need to know what that was, as well as their diagnosis, and then the MICT has to sign here. You would verify and print your name and then sign here. And you're going to copy these, right? So you're going to need 300 calls. This looks roughly about 10 to 15 here. So you're going to need at least 20 of these plus when you apply to the college. So take good notes and start early by doing this log. This immunization record here, you're going to start adding these in, but you would have already started the health immunization and reconciliation screening portion when you applied to the general registration for Kapilani Community College and you had our supplemental information for Hilo Medical Center. Remember, you're going to need the records of these immunizations first. So when you took them, a provider gave you this injection and they wrote down on a piece of paper that it was given on a date and it was given in an amount and it was given into a particular appendage, arm, or leg. Those records need to be taken to your healthcare provider or medical practitioner. They'll look at those records, verify that you've had these, and then sign those forms. All we're doing here is looking to see that those records that you turned in and that you placed here match and meet those requirements. Or we're going to have to do a little extra work by getting more information or having to take these immunizations again. All right, just a few more information here. This is why it's saying what's a positive, equivocal, or negative, or um, non-reactive. Okay, and this is our TB requirements, our two-step. Again, it's pretty simple. We'll have to get a two-step, and if it's once your two-step is done, if it's not within 12 months, we'll get a single step. All right. Okay, so here again, they're telling you what that means. Here's your essay, guys. So now, when we're submitting this, you're going to put your name, username, and you're going to go ahead and type out your document here. You can type it somewhere else and then paste it into our document. Or you can type it out somewhere else and then add it into here. Okay? So it tells you, please be concise, reflect, but only choose one of the three. Identify which one you're going to use first. Well, we can pretty much figure it out as we read it, but try not to get confused and try to answer all three. Because what we really want you to do is be concise and reflect on just one of these questions as you complete your essay. Then we're going to do our own self-assessment to see where we are as far as our profession. What do we know about it? What do we bring to the course as we're coming in to be a paramedic here or EMS provider? What's our strengths and what might be our weaknesses in the academics and in our pathway through this EMS professional background? These are contact information for other people. Again, this is a great time. We are applying to either our EMT or our paramedic level programs. We'll go ahead and take any questions that we have as we continue to fill out this application.